Welcome to your cranial nerve exam. I'm Dr. KCC ASMR, and I'm happy to see you again. Always ensuring that your health is in top priority. Let's go ahead and begin. We will start with the basics, our vitals. I'm going to get the blood pressure cuff and begin to check your blood pressure to ensure that everything is within normal range, not too high and not too low. Let's begin. Your blood pressure is at 100/60, so seems within normal range for you. All right, checking temperature, ensuring that you are not running a fever. Okay, normal temperature, 98.5 for your temperature today. Let's check your oxygen. All right, oxygen at 97% oxygen. Beautiful. Okay, so far so good per normal. Let's go ahead and check your heart to see how everything sounds. Okay. S1, S2, S3. No concerns of any heart murmur. I'm going to go ahead and check your lungs. Go ahead and take a big deep breath, and I can do it with you. And one more. Normal lung sound, no signs of fluid or anything. Okay, so we have done your blood pressure, temperature, oxygen, as well as heart and lung check. Now that all of the vitals are out of the way and everything seems normal, we will head into your eye exam. We're going to start with eye chart. So on here, I would like you to start with both eyes open and doing this line here. Can you tell me these letters? L, T, F, P, H. Very good. Now go ahead and close your left eye. And we're going to use your right eye to then take a look at the eye chart. We'll start here. Can you read this? E, P, T, C, O. Very good. That seemed to be great. We're going to go down a line to see how this one is. C, F, D, H, J. Okay, very good. And then we're going to try the tester to see if you can do this line. Please read it backwards. H, E, H, P, F, T, L. Okay, very good. Please go ahead and open your eyes. Close your right eye and open that left eye. Then we're going to do the same thing, making sure that everything is cohesive and that we're seeing at a really good rate. So again, holding the chart at 6 feet from our eyes, we have some good lighting. We're checking our eyes separately and without your glasses. So using the visual angle of 1, we're going to go ahead and now begin again, starting with this line. And please read it backwards. J, H, D, F, C. Very good. Now we're going to go down one more line, and I'm going to have you read this forwards. L, T, F, P, H. Very good. So it seems that you are within 20/20 vision. The glasses that you have are those sunglasses. Oh, they're the UV light glasses. Yes. Very good. So no concerns in your eyesight. Very healthy, seeing normally. And we're going to go ahead and check for color blindness, making sure that you can see colors the same and not mismatch. So keeping that eye closed, go ahead and tell me what this color is. Red, and then what is this color? Green. Okay. And we're going to swap that. So go ahead and close your other eye and open that right eye again. Very good. And let's begin with the other eye to distinguish the color. And I'm going to kind of flip it up on you. What is this color? Green. And this color? Yes, that is red. All right, so I'm going to use this here as well for a few different things. First, we're going to distinguish the numbers. So taking a look, and you can use both eyes, that's fine. I have this circle and this circle. What are these two circles? 6 and 9, yep. And is 6 or is 9 larger? 9, very good, okay. Now we're going to do that one last time. I have this 3. Good job. And then this one, 7. Which one is smaller? 3. Awesome. All right, now I'm just gonna go ahead and use this pupil gauge at 5 millimeters to see how big your pupils are. So a lot of times they can be very tight due to light, stress, migraines, health conditions, many different things. Or they can be large due to feeling at ease, blissful, or other health conditions. So we just want to make sure that they're reacting especially to the light normally, and there's no, obviously any underlying concerns. So ensuring your health is great. So let's go ahead here. Okay, so taking a look at your eyes. Right now they are at a 5. Okay, which is usually pretty normal. I'm going to use my light now. Okay, so now they're shrinking down to about a 3. Okay, not bad. That's really good. So starting around a 5, which is a pretty normal. And then this shrunk down to a 3, so especially with the light. So they're reacting normally, which is really good. Since we're already looking at eyesight, I would like to continue to use my light and just to check to see how everything's looking. I'm going to put some gloves on beforehand. Okay, I have my gloves. I need to use my light and just kind of peek around your eyes. Okay, so there's some red lines, veins, kind of just going through your eyes. But they're not too large and not really concerning. I don't see any jaundice, so kidneys seem to be working really well. Around. Okay. Yeah, very good. I'm gonna just check your other eye, make sure everything looks the same. Okay. So eye duct looks normal, doesn't look clogged. Red veins, but that's normal. No jaundice. Okay, very good. Do some tests here to check your peripheral vision. Going to bring my fingers into view. When you see them, please say yes. Go from there. Okay, and I think last things, I'm just going to do some numbers in the vision. So just a 1 or a 2, and just let me know which number. 1, 2, good job. 1, 2, 2, very good. 1, beautiful. Okay. eyesight is clear for what I can tell as of right now. It's going to check your facial structure, muscles behind everything, the tissue, making sure that everything's smooth, there's no signs of any bumps or any concerns per usual. I can also then check some reflexes. So let's begin just by palpating. Okay, so everything feels normal as I was doing that. I'm going to do some tapping. This is going to touch on natural reflexes of the facial muscles. I want to just relax as I do this. I get a little closer here. Okay, normal reactions. Everything did react when using this, so okay. I want to check some nerves using my acupuncture pen. I'll put it on like certain points of the face and kind of like feel around with it. Making sure that those nerve endings are also reacting as normal. Okay, nerve endings look great, reacting normal. Let's check smoothness of the skin. Good. While we're here, I'm gonna have you go ahead and open your mouth and say, yeah. Everything looks pretty normal in there. No signs of any cavities or decay. I didn't notice anything underneath the tongue, any weird abnormal cells or structures. So very good. I'm going to take some measurements of your face. Centimeters. 3 inches here. 5 inches. Inches. 4 inches. 4 inches. 5 inches. 5 inches. 5 inches. Okay, good. Check your ears. All right. Go ahead and look this way for me. I'm going to check your ears. Go ahead and look this way. I'm going to check your ears. Okay. Normal colors. Light pink. No scratches. No redness. Little buildup of wax, but not a lot. It looks really good. Go ahead and look this way. Yeah, same for this one. Everything looks really good. Normal color. All right. Ears look great. No infection, normal eardrum. Let's check some smells and taste. What does this smell like? Orange. Okay, yep. Citrus. Definitely like an orange. What does this smell like? Pepper. I would have also felt like sneezing. Okay, last one. What does that smell like? Rose. Very good. All right, we have some tastes for you next. And what does that taste like? cinnamon, yes. All right. Peppermint, oh wait, then one more. And what does that one taste like? Orange, yep, very good. I think we're going to do a quick hearing test and then you're going to be all set for today. You've done such a wonderful job. Very happy with the results. It's either genetic or you take really good care of yourself. So either way, keep up the good work. As far as this next one, please let me know if it's a snap or a clap. Snap, clap, snap, clap, snap, snap again, clap. Very good. Now, I'm going to use these guys. I'm going to rub these guys together. Let me know if you can hear it once or twice. Right, very good. I'm going to use these around your sinuses real quick. Alright, that just helps with the flow, getting everything pushed out. So, in other words, there weren't any really concerns. Alright, you did awesome today. Everything looks amazing. So, I will see you at your next exam. Have a great one.